Well, good morning, everyone.
Good morning.
Again, my name is LaPhilia Johnson, and I'm with Caddo Council on Aging. I'm the program manager for the Aging and Disability Resource Center. And what that basically means is that it is our responsibility to connect the community with resources. They call and they state what their needs are, and then we connect them with community resources. I've learned that a lot of times when talking with caregivers, they're just unaware of what's out there. There was recently, this week, a lady who has been struggling like for the past 5 years to take care of her grandmother. And I was just telling her, well, have you tried the waiver program? And she's like, I've never even heard of the Medicaid waiver program. So a lot of people think, well, once you say Medicaid, oh, well, I know I don't qualify for Medicaid, but it's long-term care. So our job is just to explain to them what resources are out there to let them know, there is help out there. One of our major responsibilities that we have is on Medicare. Now, we are SHIP counselors, SHIP, which is the Senior Health Insurance Program. It's funded under the Louisiana Department of Insurance. I know if you get the Medicare and Me book or the Medicare and You book, on the back of it, it says SHIP. If you call that number, they will connect you with us. If you call Medicare, Medicaid, 211, they'll connect you with our office. So if anytime you can't remember, I can't remember where that lady's from, just look on the back of it and they will connect you. Now, anytime I'm doing these presentations on Medicare, it's important to understand the differences in Medicare. A lot of people don't understand what original Medicare is. They don't understand what Medicare Advantage is. They'll call and say, well, I'm under original Medicare, but the insurance agent said I can get a supplement. So they're thinking they're getting something to go with their Medicare, not understanding they're changing from original Medicare to an Advantage plan. So we're gonna go over it just so that you understand the differences and some of the language that they use so that you are not confused. We're also gonna talk about scams. It's getting very, very bad with the scams that are going on. It is so bad that the government is having additional departments get involved. Our director was at a director's meeting, and the Secret Service was there to talk about scams. And I did bring you some information from it, but that's how bad it's getting. It's $1 billion fraud, $100 billion. And when you look at some of the ways that they're doing it, you can understand how if you have a senior that's alone, that doesn't understand, how they may be able to fall victim. And it's very difficult to get them to understand that they're a victim of fraud because they think it's real. So we're going to talk about that as well. And I also brought you all some goodies that we'll hand out at the end. But just starting off, do you all understand the difference between original Medicare and Medicare Advantage plans?
I don't understand the difference between them, but
Okay.
I hear bad things about the Advantage, but I don't know.
Okay.
what
So
the difference is.
So I'm gonna do this just as if you're turning 65 and you've never heard about Medicare at all, okay? So anytime someone's turning 65 and they're getting ready to end their employer health insurance and get onto the Medicare system, I have to let them know it is totally different than any insurance that you've ever had. I used to think that once you turn 65, everything was free. Medicare paid for everything. No, they do not. So we're gonna go under original Medicare first, and then we're gonna talk about the Advantage plans. So under original Medicare, you have your Medicare Part A. Now your Medicare Part A is what pays for your hospital, okay? And if you look on your sheet here, This little green side is the different parts. So your Medicare Part A is for your hospital. There's not a monthly premium for it, but you have paid for it. You've worked, you've paid your FICA taxes. It's usually 10 years, you put in 40 points. You have earned it, okay? You have paid for it. It's not free. It's just premium free, but you paid for it, okay? So it's premium free, which means you don't pay for it monthly. But of course, you know that Medicare, like all insurances, are set up on an 80-20 ratio. They will pay 80% once you have paid your 20%. But I tell people 20% of what? That's what we're gonna talk about. So you have your Part A, then you have your Part B as in boy. B as in boy is for your doctor's visits, your specialties, your specialty doctors, if you have to have lab work, things like that. That is what your Part B as in boy is for. Now, your monthly premium for Part B this year is $164.90. So every month you have a payment of $164.90 that's pulled out of your Social Security check if you elect, or your railroad retirement, or you pay it, directly to them. But $164.90. Then you have to have a drug plan. Now, when we're talking about drug plans, there are a lot of people who are on no medication. So they may turn 65 and they're on no medication. So they say, well, I don't need a drug plan because I'm not taking any medicine. Everything I take is over the counter. And then maybe when they're 70, 75, the doctor says, well, we're going to put you on a blood pressure medicine. Okay, so 10 years later, now they're on a medication. So they say, well, I need my drug plan now. So they'll go and they'll, say, okay, I need to register for a prescription plan. Not knowing, now you've got a penalty, and it's a lifetime penalty. Its penalty is calculated based on when you were first eligible to get that plan. So he's gonna have it's calculated, but basically from 65 to 75, whatever that calculates to, that's a lifetime penalty. So there are some people whose penalty is more than the monthly premium for the drug plan. So even if you're on no medicines, I think the cheapest drug plan they have out there is like $7. It's better to take that out to avoid that lifetime penalty, because the only way that you can not pay the penalty is if your income drastically drops and you qualify for Medicaid assistance. And most people, if they have Social Security, they have their retirement, they're not going to qualify for it. So it's better to just take out the lowest one to avoid that penalty, because it is a lifetime penalty. And like whatever your monthly premium is for the prescriptions, whatever your monthly cost is for your medicine, the penalty is added above that. Okay, so be aware of that. Any questions so far about parts A, B, and D as in dog? Okay. Now, you know that you have your monthly payment for Part B. You have the cost of your premium for Part D plus your cost of prescriptions. And then you're still left with your 20% that you have to pay for your deductibles and things like that. On your Part A, it's very important to know that your Part A, your deductible is based on 1 to 60 days for your Part A. So let's say if you get sick and you go into the hospital and you're in the hospital from January to February, 2 months, okay? And you paid your deductible. And let's say you get sick again and you have to go into the hospital again for another 60 days. You're gonna have another deductible that's due, okay? Part A is the one that your deductible is for 1 to 60 days in patient stay. Your other deductibles, like for your Part B and your Part D, they're based on yearly. So you pay your deductible for the year. But for Part A, it's 1 to 60 days. So be aware of that. Now, remember before I was saying 20% of what, okay? As you know, healthcare is not cheap. when you go to the doctors, it can get a little pricey, okay? So you're paying 20% of whatever is out there. Sometimes Medicare gets a bad rap, but one thing that I like about Medicare is that the doctors can charge you, they can charge you $1 million for something. Medicare has said this is what we're gonna pay, period, okay? And if the doctor accepts you as a Medicare patient, they are also accepting the terms that Medicare pays. So that is a good thing. They could charge you $1,000 for a pill. Medicare says we're gonna pay you $20 and that's it, you know, okay? So that is a good thing when you're dealing with things like excess charges and things like that. Now-
Let me throw something in right there.
Yes,
I
ma'am.
have a friend that just moved to Dallas, and that means she had to change doctors. She had a difficult time getting a doctor that would accept Medicare in Dallas.
Mhm.
So I know that same system's gonna come to Shreveport if it hadn't already.
It is.
Is it all right?
And that's one of the drawbacks of having private insurance versus Medicare. But the thing about the private insurance companies is that you're putting your health care in charge of that insurance company. You know, if your doctor says, well, she needs that surgery, the insurance company can say, we're not gonna pay for that. You know, they've had people where the doctor has prescribed medicines and the insurance company says, no, we're not gonna pay for that. So Medicare usually goes by what the doctor says, okay? Because, you know, if we're sitting in here and your doctor is saying you need this to live, we're looking at the money side of it. Are we doctors? No, you know. So that's another reason that I like Medicare is they look at what the doctors say, if it's if there's a medical necessity. Another thing that I've noticed is that some private insurances are trying to act like Medicare. Some private insurance are saying, well, we're gonna cap what we're gonna pay. And the client or the patient ends up getting the bill because these doctors are like, you're not Medicare, we're not gonna go for that. So I have seen a lot of private insurance companies do that as well. It probably is, you know, making its way down to Louisiana. I know that for a while, it was very hard to find a doctor to accept Medicare simply because of the way that they pay, you know. But if you're on, you know, if you have a doctor and you transition over to Medicare, usually doctors will keep you because you're an existing patient, you know, so usually there's no problem with that. So yes, ma'am, that is an unfortunate, you know, side effect of this financial system that we call healthcare. Yes, ma'am. Okay, so with your with your original Medicare, you have your Part A, your Part B, and your Part D. You can add in a supplement plan. It's also called Medigap, okay? True supplement plans, you pay for monthly. If someone says, well, I can get you a supplement and it doesn't cost anything, they're probably talking about an Advantage plan. And we're gonna get into that, okay?
Is that what's called a Plan F on a supplement?
No, a supplement, now if you have a supplement, you can get plans A through N or something like that. That is a true supplement, but you pay for it monthly. And there's certain benefits that you get with a supplement plan. So if you see something that says Plan N, Plan F, that is a supplement, okay? Don't confuse that with parts, A, B, and D. It's not that, it's actually the supplement plan. You will pay for it monthly. Usually people that are on original Medicare with a supplement, they pay their monthly fees, and then when they go to the doctor, everything is taken care of. So a lot of people like that. They say, I know what my, you know, expenses are gonna be every month. I just pay it, and when I go, they just say, have a nice day. You know, there's nothing additional out of pocket. Any questions on original Medicare? Okay, a lot of times the reason that people don't stay under the original Medicare system is for finances, okay? You have your Part B premium that's due monthly. You have your Part D premium that's due plus your cost of medicines. And then if you add in a supplement plan or a Medigap plan, now you've got that monthly expenses. So just imagine if your check is $900 a month. By the time you pay your premium $164.90, I mean, do you have a lot left to pay a supplement plan on top of that? So a lot of people go to the Advantage plans simply because of finances, okay? Now, with Advantage plans, I don't want you to think that they're scams. They're legitimate plans, but it depends on if it works for that individual, okay? It depends on what your health needs are. If you are a recurrent patient and you're going to the doctor 4 and 5 times a month, and each time you go to the doctor, they send you to a specialist, and they send you to get this test, and they send you to get that test. Each time you go, you're gonna have a what? A copayment, and that can get costly. I've talked to people, and they says, I've got so many appointments this month, I'm looking at $500 just this month alone under the Advantage plan. So I said, well, have you considered original Medicare with a supplement? It could be $150, could be $200, just depends on the plan that you get. They say, well, I can't afford that. But you have to look at what your out of pocket is. You're paying $400 or $500. Isn't it better to just pay $200? You know, so it depends on your health needs. If you're healthy and you only go to the doctor to get, your yearly annual visit, you're not on a lot of medicines, it may work for you, okay? There's a lot of advantages with having a supplement plan, a Advantage plan. They give you, it includes a prescription plan, more than likely. Some of them will pay a portion or all of your Part B premium. It just depends on which plan you choose. They have silver sneakers that you can get. Some of them give you the over-the-counter prescription cards. Some of them will give you a food card where you can go to Kroger or Walmart. It could be up to $200 monthly that you get. So there are a lot of advantages to having an Advantage plan. However, these Advantage plans are for your health insurance. So a lot of people are looking at the perks, but they're not looking at the health side of it. And I say you have to look at if your health needs are taken care of first. Then you look at the perks that you get. One lady changed her from original Medicare to an Advantage plan because she wanted that over-the-counter card. She wanted that $200 card. And when she went to have her port flushed, I said, ma'am, did you change your insurance? Your insurance doesn't cover that. And if you need your port flush, you need your port flush, right? You don't have time to be going to the doctor saying, haggling with the insurance company. So those are the questions you need to be asking before you switch plans. That food card may be great, but you don't need it if you're in the hospital because you can't get your port flushed. So make sure that your health needs are taken care of first. You want to look at what your out of pocket is going to be. If you're looking at an Advantage plan, what is my yearly out of pocket, okay? If your yearly out of pocket is $5,000 to $10,000, you need to look at that plan carefully. Now, we use brokers. Our brokers have been with the agency for many years. They are vetted by the Louisiana Department of Insurance. The reason we use brokers is because a broker can sign you up under any plan. They're not like insurance agents. If you have an insurance agent for an insurance company, that company is the best thing out there because that's their company that they work for. Brokers can sign you up under any plan. And what I tell people is that you can do a plan comparison. You have to ask for it, but it's a plan comparison where they look at all of the plans out there, and based on your needs, they can say, this one would work well for you. It's based on your health needs. You could have a husband and a wife. They can have 2 different plans because it's based on their health needs. I tell people getting an insurance plan because it works for your neighbor or if it works for your family. That's like wanting to take their bag of medicine. You know, would you just take somebody else's bag of medicine? No, because their medicine is specifically for them. So make sure that your health coverage works specifically for you. Okay? Any questions on Advantage plans?
Where would you get this comparison workout worksheet? Where?
From the brokers. And we have, if you call our office, we have a listing of brokers that we can refer you to. Stuart Rose is one of them. I know Gary Blair is he's somewhere on Olive here.
Is that with Providus?
No, I don't think it's Providus.
Okay.
I know, but I know he's somewhere on
What's your
Olive
office
here.
number?
It's on there, 676
79.
7900, yes. And when you call, that goes directly to the resource center, and you just say, we need, I need a plan comparison. I need the information for the brokers, and we can connect you with them. But she asked for a plan comparison. Another reason that I like the plan comparison is that they can tell you what the trends are with those insurance companies. You know, sometimes when you first turn 65, you could get a plan that's $85, $100, it depends. But they can tell you the trend is, they update their plans every 6 months or and then even though you're paying $85 now, by the time you're 70, you're gonna be paying, $200 or whatever the case may be. But they can tell you what the trends are. So that's a good thing also, but it's a plan comparison. And they can tell you some good stuff that's out there. Now, some people have said, okay, financially, I know I can't really afford original Medicare, so I'm gonna try an Advantage plan. And they ask me, they say, am I playing Russian roulette with my health, okay? Because when people are on Advantage plans, when they really get sick, they wanna come back over to original Medicare, okay? So here's some issues you need to be aware of. If you are on an Advantage plan, and let's say you got an Advantage plan when you were 65, and now that you're 70, you're having some serious health issues, and your Advantage plan is gonna cost you $100 a day just to go into the hospital. And you say, right off the bat, I can't afford that. I wanna go back over to original Medicare. And it's a lot of agencies like hospitals that'll say you need to call and get put back on original Medicare, okay? So you say, okay, I wanna go back over to original Medicare. Okay, you've got your A, you've got your B, and you've got your D, okay? It may be an issue getting a supplement plan, okay? Because you're gonna have to pass underwriter, okay? And from what our broker said, it's about a 5-page survey that they ask you different types of health questions. And if you have something on there, they don't have to sign you up. From the information that we've been given, when you first turn 65, they have to accept you on the supplement plan, no questions asked, because that's when it's first made available to you. So, well, I don't want to say no questions asked, but no health, it doesn't count against you. But after that, going from an Advantage plan to original Medicare, and trying to get a supplement, okay? You can definitely get your A, your B, and your D. But if you're trying to add the supplement that helps you with that 20%, that's where you're gonna have to go through the underwriter, okay? So just be aware of that.
I've never heard anything good about Advantage plans.
Well, it depends on your health needs, like I said. If you're having a financial, when we use the example, like your money is $900 a month, you kind of don't have other resources out there, because a supplement plan could be $150 to $200. Already, your Medicare Part B is $164.90, so you have to look for alternatives, because of your income. Now, there are some Medicaid programs out there that can help pay your Part B premium for you. So that's a good thing to look at. But even if you can't get the supplement plan, you're still under the Medicare system. So it still may be okay for you. That's what you do the comparison for, to see what your out-of-pocket is gonna be. So just be aware of it. There's a lot of things that people are just not aware of until they get into it. You know, even though they may offer dental, it's not the dental that you would think of when you were working. You know, they may do teeth cleaning, they may do something more detailed, but you have to see what type of services they offer to see if that would help you. They may do vision, but it's a limit to it. So you have to look specifically at what they're offering to see if that would even help you. So you have to be careful, but a lot of people, they don't ask all those questions ahead of time, and then once they're in it, they say, well, oh, I didn't know I would have an expense for this, I didn't know I would have an expense for that. So those are the things you have to ask ahead of time before you get into it. Yeah, so it just depends on what your situation is. There's some people that love their Advantage plans, but it's based on what their health needs are. And then there's some, it's the worst decision they've ever made, you know, so it just depends on that individual. Okay? Okay. And before I go, I definitely want to talk about scams. A lot of people have said they go to the doctor and they say, did you change insurance? And I say, no, I didn't. Well, you don't have the same insurance anymore. Okay, so they said, Mama, Daddy, have you talked to somebody and told them to change your insurance? You have to be very careful with answering the telephone, okay? These agents are calling when open enrollment starts. It gets worse, okay, with the telephone calls, with the mail that you get, but it gets worse and worse. If you call and they can say, hey, they could tell you everything, and then you could say, well, doesn't that sound great? And you can say, yeah, that does sound like a great plan. You may have just given them, you know, permission to sign you up for it, you know. It is a very sneaky, underhanded way. That's why calls are being recorded now. So if you talk with an agent or a broker, they're supposed to be recorded, okay? Because of all of the fraud, so that they can actually go back and listen to this call to see what you actually said.
But if it's a scammer, that's not gonna be recorded though.
Right, so that's why you have to be very careful.
And then I heard on the news last night that when somebody calls you and they ask, can you hear me? And you say, yes, don't do that.
Don't
say
cause
yes.
Don't, yes. So it's like, and one lady I talked to, and she was in a different parish, but she was saying that they called her and she says, I don't need your insurance company. I've got this and I've got that, and I don't need. And I said, even though you think you're doing right, you actually did wrong, because now you're telling them. You just told them what type of insurance you have. So you actually just gave them some missing pieces to the puzzle, you know. Don't tell them anything. Don't say anything. You have to be extremely careful. Medicare, Medicaid, Social Security is not gonna call you unless you call them and said, give me a call back, okay? Other than that, they're not gonna say, are you happy with your health insurance? Is everything going okay? They're not gonna do that. They're not gonna say, you're turning 65, let's go out to a meal. They're not gonna do that. But people present themselves as Medicare. You're turning 65, we're gonna go out to a buffet. They're agents that are signing you up, and they're not supposed to do that. So be very careful when you're answering the phone. The information that I sent you, I have a magnet to give you all for the Senior Medicare Patrol, where you can actually report fraud. But before we get into this, which is from the United States Secret Service, when you get your monthly, well, quarterly, I believe they send them out quarterly, your explanation of benefits, your EOBs, are you all looking at those?
Yeah.
Okay, tell me what you're looking for.
Make sure the service is on the date and look for the doctor's name, because it kind of throws you sometimes when it's a radiology or something like that, but to look at the dates.
So I brought you all this book, and it's from the Senior Medicare Patrol, and it's the My Healthcare Tracker, okay? And in this book, you can actually write down the date that you had your appointment, and you can actually check and list what you had done. If you go to the doctor and you have to see, if you have to go to 2 or 3 different departments, like, I don't know what that doctor's name was. Where did I go? Did I get this lab done? You really don't know. So this, you can write it down. It's very little. It can fit in your purse. You can write it down, or men can put it in their back pocket so that you can know what you had done on this day. So when you get your EOB in the mail, you can say, hey, it matches. This is what I had done. Now, one lady,
EOB comes in the mail and it'll have anybody but the doctor's name on it. The PA.
mhm.
And it irritates me to death.
Now, did
I
you
don't
see
know
the-
those PA's
Did you see
names.
the PA?
Yes, but they maybe will have more than one PA, and the next time I'll see another PA.
So you write down which PA you actually saw on that day. I actually saw Dr. Smith, or I actually saw Dr. whoever the PA was,
What's in the PA's name?
and write that down. Because if you're seeing a different doctors, you will not remember.
I know. And
That is what this is for. You like, well, what did we talk about? What did they prescribe?
Yeah.
Who knows, you know? So this is what this is for, so that you can keep a track of it. If you don't have this, put it in your phone. You know, ask the doctor, do you have a card? You know, I need your card so I can keep up with what we had done, okay? So that when you get those EOBs, you can say, yes, this is the doctor that I saw. This is the procedure that I had. Be very careful with telehealth, okay? One lady I spoke to, and she's locally in Shreveport, and she said that she had a telehealth visit. That's where the doctor, you know, looks at you over the computer screen or your smart device. And so she got her explanation of benefits, and they charged her for checking her blood pressure and something else connecting to the computer. Somehow you connect the computer through this blood pressure device, and it takes her pressure. Well, number one, she doesn't have a computer. So there's no way you could have connected this blood pressure pump to the computer that she doesn't have, okay? And she was charged for both of those. So she called the doctor, and she says, I did not receive these services. And their answer to her, locally in Shreveport, is that you're not paying for it. Don't worry about it.
Oh dear.
Oh dear, okay? It may not be coming out of her pocket, but who's paying for that?
We are.
We are, okay? You don't want to be charged for services you did not receive, okay? It doesn't matter if you don't have any out of pocket to it, it's still being charged to your benefits. So someone is getting paid for services they didn't perform and that you did not receive. What is that called?
Medicare fraud.
It's called Medicare fraud, okay? If there's
So
one,
who do we report that to?
you've done the right thing by starting off with the doctor. This needs to be removed. I didn't have that. If they don't do it, then you can go to the insurance company. If they don't, then you report it, okay? You can also report to Medicare. They can tell you the steps to go from there. The senior health, and the number is on all of these for the Senior Healthcare Patrol. But you have to report that. And you want it removed because you don't want to add to this billion-dollar system. Some of the mistakes, some of them are mistakes. You know, you have to put in, I think it's a 10-digit code now for ICD-10, I think it is. So you could be a mistake, just data entry mistake. But some of it is purposeful, you know, and if someone says to me, well, you don't have to pay for it, well, how many clients are you charging for this and they didn't receive that? So, you know, if it's $500 for this one client and you've done this to 10 patients, that's a pretty good paycheck, isn't it? For services you never even had done.
Then you start the task of finding another doctor that'll take a Medicare patient.
But I
It's
mean,
going on in every aspect of our life. This morning I picked up a receipt from a lunch I took home on Sunday, and I have a 39-cent beverage charge. and I did not get a beverage. I merely got the plate dinners. And just that 39 cents on that, they made me so mad.
You want your, and let me tell you something, I worked for, the federal government, and millionaires have called in, millionaires. And they said, I've calculated this, you calculated this, they were off by a penny. And they says, I wanna know where that penny is. We want every penny, don't we? If it's our penny, we want it, right? So even if it's 39 cents, I didn't get my beverage, why are you charging? Cause just imagine if they have 100 people coming in,
Oh, well,
and they're charging everybody 39 cents for
Absolutely.
something, yeah. So, nothing is too small to report, okay? A lot of people looked at their, EOBs, and one gentleman was charged for an ambulance ride. He says, well, my daughter took me from this place to the next place, I didn't have an ambulance, but it was on his bill. So, those are the kind of things that you're looking for, charges of services you did not receive, okay?
And you can also ask for an itemized bill,
Mhm.
and it will lay out cause you know, an EOB is just like basic. You can ask for an itemized, and it lays out
From
every
the doctor's
single,
office.
yes,
Yeah.
every single thing that doctor did, and really lay into it and make sure it's all above board.
Okay. And this is from the U.S. Department of Homeland Security, and it talks about do's and don'ts. It talks about, grandparent help, kidnapping scams. I think we all saw that on the news recently with the scams that are going on. People are doing anything these days. They really are. So you have to be careful. But they do something that's called phishing. And what it is that their phone numbers, their email addresses, it may look similar. Have you noticed that the callers now have a 318 number? You know, used to be it was an 800 number, and you look, you say, oh, I'm not answering that, that's an 800 number. Well, they got smart, and they said, well, we'll use local numbers now. Hang up the phone, okay? We don't need anything, don't call me goodbye. You can get put on the do not call registry, and then there's a national do not call registry, but you have to look at how long it lasts, because you do have to keep updating it periodically. So remember that, phishing scams, be very careful with getting links to your text messages. Don't click on those links, because if you click those links, they could access your personal information. The same thing with emails, text messages, apps. So there's a lot of information in here. I believe it or not, there's a romance scam that's in here. And believe it or not, I have talked to probably about at least 2 or 3 people in the last year that their loved ones was a victim of a romance scam. And the problem was, and this was an older person, and the problem was convincing them that it's a scam. I mean, the person on the other phone was so convincing, they didn't believe it. And I'm trying to think of, something happened, and they were going to, what do you call it when you can go and get the money quick, like route it to me, what is it?
Wire transfer,
Yeah, what's
like Western
that?
Union.
One of those. And so they were going to Western Union, and they were trying to catch them when they were doing this. And the person on the phone was like, they're trying to break us up. They're trying to do this down. And so the person left out, and they directed them to go to another one to get it done. I mean, these people have them, I can't, they're not hypnotized, they're, I can't think of the word, but, well, that's a one. Yes, that's what I'm looking for.
Yeah.
Brainwashed. It's like they really think that it's real, and it's very, very hard to convince them that it's not. But these are people that they're at home all day. They don't have anybody to talk to. So hey, someone called and they're nice to me, you know, and they start off wonderful, and then, hey, can you send me $1 million? Well, sure, honey, That's how it starts. So be very careful. You may think, oh, nobody's gonna fall for that, but they have, and it's very hard.
Just watch Dr. Phil.
Yeah, and it's very hard. It is very hard on the children, to try to get their loved ones out of it. So be very, very careful of that. Let's see, the romance scam. I'm trying to think of what else is on here. I know that, let's see, they also said that these quick gift card offers, like you've won this, you've won that, be careful with those. Also, they'll call and say, your Medicare card is about to expire, you need a new one. Your Medicare card is your card. You don't get another one. I can't believe they're still trying that one, but they are. So just be careful with that. About frauds that's going on. Like it is it's $1 billion.
Is there anywhere you can report those, or is it just a matter of hanging up because they're gonna call the next person?
I mean, if you have the number, you can definitely call and report it. Anytime I get an email or something like that, I send mine to TIGDA, which is the federal one. So you can definitely forward that on to
Say TIGDA?
TIGDA, and report that on.
That on an email?
Yeah.
Okay.
Yeah. So I'll have to give you the email. It's in my phone, but I'll have to give you the email for it. But I send everything to
E-TIGMA?
to TIGDA.
TIGDA?
TIGDA.
T-I-D?
GA.
G-I? Okay.
GA.
G-A.
I'm trying to think if there's anything else. Any other questions that you all have? Be very careful. I also brought you some information about heat and heat related health. We are in some unusually hot weather. One gentleman came in and he actually was a victim of a heat stroke, and he said that one thing that people aren't aware of is that if you're still sweating, that's a good sign. But if you're ever out in the heat and you stop sweating, it's time to get to the emergency room, because so yeah. So if you're out there and you're hot and you're not sweating, yeah. So if you're still sweating,
I'm still sweating.
yeah, exactly.
And I wanna say that if you have some paper, your EOBs or something comes in, or your statement, like I have Humana, and I get jillions of papers, and I go over them. If some of them just looks fishy, it pays to investigate.
It does.
For example, my husband was in the hospital for 3 days because he fell out of the bed. Well, it was miscoded,
Mhm.
Oh,
and
yeah.
that was the reason they declined the claim. But I just took my little papers with me down to the Humana office,
Mhm.
and there was a very nice lady there, and she knew how to file the claim right instantly. She did it on the fax, and I had a return copy of it that I walked out of the thing with. It would have taken me probably 3 letters back and forth, trying to figure out if I got the right department, or he
Right.
didn't do this right or that. So, check those, coding numbers, not that we know them, but there's errors that can be made there because they're coded humanly.
Yeah, and I'm so glad that you did mention that, because anytime you get something that's denied, you always want to appeal it. Anything that they don't pay for, appeal it. Like she said, she called Humana. I have had procedures or whatever where the insurance wouldn't pay, so I called and I said, why wasn't this paid? And they'll tell you, and they'll say, well, it's based on the coding. Well, what code did they use? And they'll tell you specifically, what that code is. We may not understand what it is, but you know layman's term. If you're diabetic, you didn't go in to have your nose amputated. We know that much. So definitely make sure that you call and.
Well, my point is really just to appeal it. 'Cause that was the first time I've ever, you have to do all this written stuff to appeal some charge. But that lady took care of it for me, and consequently, the total bill was somewhere over 3,000 for our part. And I got it down to, I think it was $72.
Okay.
Oh, wow.
So it was worth the effort.
Yeah.
That's the first time I've ever appealed one.
Yeah. Yeah, and there's some people that, it may take a little bit more effort on your part, but I would rather, like the lady said, put in the legwork to pay $72 versus $3,000. It's gonna be worth it in the long run. And even if you have to pay the big bill, at least you know that's correct and that is your bill. And you're not being charged something that you shouldn't have been charged. So yeah, definitely appeal. And then it also, you know, gets into a different set of eyes that are looking at it, because a lot of things are done on the computer. And they put those numbers in and the computer generates it, and you know, the computer says nope, you know, so now you've got an extra set of eyes that's looking at it. And she went there and she says, oh, I can see, you know, clearly what the problem is. So that's a very good practice to have. Yeah.